time. So so if they deploy at 12:30, they put it in at 12:30, and then your ambulation time, depending on who it is, will, Dr. Narco is usually 4 hours. So occasionally he might do 6. So if it's 12:30, then you know ambulation time is going to be 16:30.
So you have to ask doctor like what's the time for deploy?
Just if you're unsure, just ask. So Dr. Etiquette is no longer here. She did her last procedure. I mean, she's here through next week. She did her last procedure Monday. So it'll be Dr. Narco. We do have somebody new coming in a couple of weeks. So I don't, we'll have to learn her preferences. But so most of the time it's artery left or right. So if it's the right leg, they usually go on the left. So it'll be left artery. Or occasionally we might do it in the vein. Most of the time it's artery. So just deployed by, so if it's deployed by Dr. Narco, put Narco down. If it's the resident, put the resident name down. And then the lot number, if you want to put that down, which I guess technically we probably should since it's on the sticker, you can get the lot number off of here. Or just put one of these stickers on here. So, but those are the stickers. I am guilty of not using this sticker here. I haven't been put on the dressings, but moving forward, we will be. And then, but just make sure this is on the chart. And then just tell your nurse when you get to recovery or ICU, wherever, ambulation time. And another thing that I typically do, it's just my personal preference, I always put a nurse's note in the chart. Like if I've called report to ICU or whatever, I include that in my charting that I've called report at what time. But also on the MYNX, right growing site closed with MYNX at 12:30, patient to remain supine times 4 hours, ambulation time 16:30. I always put that in my note just so that it's documented, because what happens if it's not documented? It didn't happen, right? So that's just to cover you, and then so the patient gets what they need also.
Okay, my question is that when they are using this one, I don't know.